Tooth extraction may sound intimidating, but it's a common and safe procedure dentists perform regularly. While every extraction experience varies slightly, understanding the process can help ease any worries and provide insight into what you can expect. This video breaks down the stages involved in a tooth extraction and offers essential aftercare tips. What is tooth extraction? Tooth extraction is the removal of a tooth from its socket in the bone. Dentists typically recommend this procedure if a tooth is severely damaged, infected, or causing issues like crowding. Extractions are generally classified into two types: simple extractions for visible teeth that are easy to remove, surgical extractions for teeth that are broken, impacted, or hard to reach, often requiring a more complex approach. Reasons for tooth extraction. There are several reasons why a dentist may suggest tooth extraction: severe tooth decay or infection, when a cavity or infection reaches deep into the tooth's pulp and cannot be treated with fillings or a root canal. Impacted teeth such as wisdom teeth that are stuck beneath the gums and pushing against neighboring teeth. Overcrowded teeth. In cases where teeth are too crowded, pulling one or more can make room for orthodontic treatment. Gum disease. Severe periodontal disease can weaken teeth and surrounding bone, necessitating extraction. Step-by-step tooth extraction process. 1. Initial examination and X-rays. Your dentist will examine the tooth and surrounding gum tissue to assess the condition. X-rays are often taken to visualize the tooth's position, root structure, and bone condition, helping the dentist plan the extraction. 2. Preparation and anesthesia. To make the process as painless as possible, the dentist administers local anesthesia around the tooth to numb the area. For complex extractions or patients with high anxiety, sedation options like nitrous oxide or IV sedation may also be provided. 3. Loosening the tooth. For a simple extraction, the dentist uses an instrument called an elevator to gently rock the tooth back and forth, loosening it from the socket. The goal is to break the ligaments holding the tooth in place so it can be removed with minimal pressure. 4. Removing the tooth. Once the tooth is loosened, the dentist uses forceps to gently lift and extract it. For surgical extractions, the process may involve making a small incision in the gum to access the tooth, and in some cases, cutting the tooth into sections for easier removal. 5. Cleaning and closing the socket. After the tooth is removed, the dentist will clean the socket to remove any remaining debris or infected tissue. Sometimes a stitch or two is used to close the gum tissue and help it heal faster, especially for surgical extractions. 6. Gauze application. A gauze pad is placed over the extraction site to control bleeding. You will be asked to bite down gently to apply pressure, which helps a blood clot form in the socket. This blood clot is vital for healing and prevents the bone and nerves from exposure, reducing the risk of a painful condition known as dry socket. After the procedure, you may experience mild discomfort, swelling, or even some bleeding. Here's what you can do to help manage these and promote healing. Apply ice. To reduce swelling, apply an ice pack to the outside of your cheek for about 15 to 20 minutes at a time. Take pain medication. Over-the-counter pain relievers like ibuprofen can help ease discomfort. Your dentist may also prescribe medication if needed. Keep the area clean. Avoid rinsing or spitting forcefully for the first 24 hours to keep the blood clot intact. After 24 hours, you can gently rinse with warm salt water to clean the area. Follow eating guidelines. Stick to soft foods like yogurt, mashed potatoes, and soups. Avoid hot, spicy, or crunchy foods that can irritate the area. Avoid smoking and straws. Sucking on a straw or smoking can dislodge the blood clot, which could lead to dry socket. How long does recovery take? Generally, it takes about 1 to 2 weeks for the gum tissue to heal fully. However, the initial discomfort usually subsides within a few days. Full bone healing may take a few months, especially for surgical extractions. Possible complications. Though complications are rare, it's essential to be aware of signs that could indicate a problem. Dry socket, severe pain, 2 to 3 days after extraction, often due to a dislodged blood clot. Infection, persistent swelling, fever, or foul taste in the mouth could signal an infection. Excessive bleeding. If bleeding doesn't subside within a few hours, contact your dentist. Is tooth extraction painful? With local anesthesia and sedation options, The process is typically painless. After the procedure, mild discomfort can be managed with medication. How long do I need to wait before getting a dental implant? It depends on how quickly the site heals, but you may need to wait 3 to 6 months after extraction for the bone to be ready for an implant. Can I brush my teeth after an extraction? Avoid brushing the extraction site for the first 24 hours. Afterward, gently brush around it without disturbing the area. When can I return to normal activities? Most people can resume normal activities the day after a simple extraction. For surgical extractions, it might take 2 to 3 days. Understanding the tooth extraction process can make a big difference in managing your expectations and recovery. Remember, your dentist is there to answer any questions and ensure you have a safe, smooth experience. If you think you might need an extraction or are experiencing tooth pain, schedule a consultation to discuss the best options for your dental health. For more dental tips, log on to smile-wide.co.in.